I mean, no, I guess I understand that it seems like it's hard to believe, because it is, because the progress that you do make is just, it's incredible.
So we want to take a look at some of her cognitive function scores. These are from Lumosity. And if you look at all these graphs, they show very little improvement over the course of 18 months. This is with all the formal training and cognitive rehab and speech therapy training and anything you could imagine at a very high level from a tertiary neurological institute. In the upper left-hand corner here we see cognitive scores for attention, and you can see that flat line transversing almost 2 years, and all of a sudden we institute the cranial nerve non-invasive brain stimulation, and you can see the score just skyrocket. If we look at the graph in the upper right, you can see same kind of idea, that there's a small improvement early on, and then for 18 months flat line, and within 4 days of instituting the PONS treatment, the score for mental processing speed just skyrockets. In the lower left-hand graph, you can see that this graph's a little less dramatic, where there's some improvement. She started to improve over time, but again, the application of the PONS and the advanced neuro-rehabilitation training that she received, and this is in a 4-day span. That's why the dots are all overlapping there, but you can see again, this is for word fluency. And finally, the graph at the lower right, you can see same idea, very little improvement over 18 months, and then just this huge takeoff in scores. This is for problem solving. Now, these cognitive improvement scores and the graphical illustration of them are very important, because this patient was an attorney and had to take off work. She was totally disabled due to mainly cognitive and some physical injury she sustained in this motor vehicle accident.